Hello and good morning. This is Dr. Yonet coming to you with another episode of Baby Talk. I missed our interaction yesterday. As I said previously, I went to take my son to school, so it took us a while to get him unpacked and then get back home. I wasn't able to join you, but today I am happy to share with you another episode in Baby Talk. And today we are talking about a condition rather than a development. We are talking about a condition named or called cerebral palsy. And I want to go through a little bit about what it is, how it's caused, and then what to expect in your baby in regards to cerebral palsy. Now, cerebral palsy is really a group of disorders that affect a person's ability to move and maintain balance and posture. So it is one of the most common motor disabilities in childhood. And cerebral means, or cerebral has to do with the brain. And palsy means weakness of the muscles. Okay? Weakness or problems with the muscles. So cerebral palsy is caused by what we call abnormal brain development or damage to the developing brain, and that affects the person's ability to control his or her movement. What are the symptoms of cerebral palsy? The symptoms will vary from person to person, but a person with CP, as it's called for short, might need to use special equipment to be able to walk, or might not be able to walk at all and might need lifelong care. Now, this information is being shared based on information provided by the CDC. A person with cerebral palsy, on the other hand, might walk a little awkwardly. Another person might have this condition where they're walking a little awkwardly or might not need any special help. So the symptoms vary from person to person. But one thing you need to keep in mind is that if a person has cerebral palsy, it doesn't get worse over time. Though the exact symptoms may change over a person's lifetime, you can get worse and worse and worse with cerebral palsy. There are different types of cerebral palsy. There's a stiff muscle type, there's an uncontrollable movement type, there's a poor balance and poor coordination type. And then we have what we call spastic cerebral palsy. And spastic cerebral palsy is the most common type of cerebral palsy that there is. And this type affects 80% of people. When you have spastic cerebral palsy, these individuals have an increased muscle tone. It's spastic, it's tight. This means that their muscles are stiff and may result in movement that is a little awkward. There other parts of the body can also be affected with spastic cerebral palsy. And I am not going to go into any more details with that. There's also what we call mixed cerebral palsy, ataxic cerebral palsy. But let's look at the early signs. How do you know? How do you know that your child has cerebral palsy? These are the early signs of CP. And the signs vary, like I said earlier, the signs vary from individual to individual because there are many different types of cerebral palsy and different levels of disability. But the main sign that you want to look for in a child is a delay in reaching motor or movement milestones. So we've been talking about milestones for a while. What are these milestones that you may find your child has a delay in that may indicate an early sign of cerebral palsy? Your child may have a delay in rolling over, in sitting up, in standing, or even in walking. Okay? Pay attention to those. Remember, you've been journaling and you are seeing how your child is developing. Take note if you see delays in these areas. Also, Some children may have difficulties with let me back up. So again, I want you to make sure that you are journaling and that you are taking note of what your child is not doing in terms of motor development. So in a baby that is younger than 6 months of age, these are the signs that you would notice. His head lags when he sits up or while he is lying on his back. He has he feels stiff when you touch him. His body feels stiff. Or he may feel floppy when you hold him up. When he is cradled, when you cradle him in your arms, he or she seems to be overextended. His back and his neck constantly acting as if he is pushing away from you. And then when you pick him or her up, his legs get stiff and they cross or they scissors. They get into this lock kind of way. And this is for babies younger than 6 months old. If your baby is older than 6 months old, these are the early signs that your child may have cerebral palsy. He or she does not roll over in either direction. He or she cannot bring his hands together. Remember, we talked about bringing the hands together and teaching your baby how to clap. He or she has difficulties bringing his hands to his mouth or her mouth. And he or she has difficulties reaching out with only one hand while keeping the other hand fisted. So everything goes. Instead, he doesn't have that coordination. He or she cannot separate the two sides of the body. Now, if your baby is older than 10 months old, now these are the signs, the early signs that indicate that your child may have cerebral palsy. He crawls in a lopsided manner. In other words, his crawling is not coordinated, it's not symmetrical. He may be crawling on one side in a lopsided way, pushing on off with only one hand and one leg and then dragging the other leg as he goes. He or she scoots around on his bottom or hops on his knees but does not crawl on all fours. And this is for babies 10 months of older than 10 months of age. Okay? He's crawling around in a lopsided way and he scoots around on his bottom or his buttocks and he doesn't get on his knees to do the all fours for crawling. Now, if you notice, you are your advocate for your child. If you notice any of these delays in your child, please speak with your child's pediatrician and get the help you need. Your doctor or the pediatrician will do a screening and diagnosis at an early age, and this will be very important to helping your child with his or her developmental milestones. So you want to look at the screening, rather, will look at developmental monitoring. The doctor, the nurse will monitor your child and track him or her for growth. You're going to look at developmental screening where your child will be exposed to some short tests so that we can specify whether the child is having motor delays. And then we want to do developmental and medical evaluation. And this here, the goal is to diagnose the specific type of disorder that your child is experiencing. Now, treatment and intervention services, and I always talk about early intervention services. Treatment, let's start with that. I'm sorry to let you know that there is no cure for cerebral palsy. But treatment can improve the overall lives of those who have the condition. I know of people with cerebral palsy who have gone to college and who are living a successful life. But, there are still those conditions and symptoms that impact that individual. But if you get, so there's no treatment for CP. It's important, though, to begin a treatment program. There's no cure, I should have said, but a treatment program that's begin as early as possible will give your child the best option for success. Okay? There is early intervention where the child gets the services in the home, and then there is school intervention where the child continues to receive services within the classroom setting. Within the classroom setting. Now, if your child has cerebral palsy, I want to encourage you to love on your child, to work with your child. It's not the end of the world. Children with cerebral palsy are loving, kind children who you can work with and you can bring to a successful outcome in life. Make sure you get your early intervention services to help you. This is Dr. Yonette saying to you this morning, take care of your baby, whatever condition he or she may have. Take care of your baby. For you to know if your child is not developing well, you need to take care of your baby, journal so that you can see where he or she is and get the services you need. I also want you to take care of yourself. Take care of yourself, spend time with yourself. And then if you find that your child has a cerebral palsy, you also need to take care of yourself emotionally so that you can get through this experience with the support you need as a parent. Thank you for joining me this morning. I invite you to come again tomorrow as we do our playtime with baby, and have a wonderful day.